Hello and welcome to this Health Suppliers segment here on Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. Our guest is returning to speak with us, Reggi Kemp. She's the CEO of Texas-based Kemp & Sons General Services, and she's joined today by Patience Rose, her business analyst with Kemp & Sons. And they're going to talk with us today about TNKA, the Trans-National Kempt Association. And Reggi, thank you so much for joining us again today. It's been quite a while since we've had a conversation. How have you been?
I've been really well. Thank you for having me.
Great. And Patience, nice to meet you for the first time. Thank you for joining us on the program today as well.
Well, thank you so much, Bill. This is a wonderful opportunity. We're so excited.
Well, Reggi, as I said, you are the CEO of Kemp & Sons General Services. Just a little bit of background about your company, those of our listeners who haven't had an opportunity to hear some of your other segments.
Okay, well, Kemp & Sons General Services, we're actually a cleaning company, and we were formed in 1972, so we've been around over 45 years. And because we've been in the industry so long and we've seen so many disparities, we decided to work on other things that would help our industry substantially. Thus, we now have Trans-National Kempt Association, which we call it TNKA. And the goal of TNKA was to bring a group of people together or a community of people together to make sure that we are establishing the right governing body and rules to make sure our industry is able to survive. And also, we're concerned about the public health globally, not just public health globally. And there are so many things that need to be established in place in order for people to be safe.
Are these rules, suggestions, regulations? How staunch are these rules that you're talking about? Isn't this industry regulated already by the government?
I'll let Patience speak to that.
Well, we did quite a bit of research in last year to look to see what the government actually regulates. And as we started looking into the development of this organization, what we found, Bill, is that there are literally no regulations in place for the industry, not here in the United States. And one of the things that was really kind of interesting is when I started looking into the Department of Labor's requirements for people who work in the industry, there are no requirements for a person to become a maintenance person or janitor or custodian or anything of that sort. There are no certifications that are required, and so they can mix chemicals how they want. They can go in and do whatever they want while they're cleaning your establishment, and literally you are just at the mercy of whoever it is, of their own integrity, as to whether or not they do a great job, or for that matter, their own knowledge, because sometimes they just don't know.
That's amazing to me. As many times as I've seen people going in and out of buildings, all different types of buildings, hotels, airports, cleaning, schools, I was under the impression that there were some types of regulations. I mean, they use a lot of chemicals, as I'm sure you do, Reggi, in your business. Lots of chemicals that will need to have a little bit of expertise behind pouring them together, right?
Right. Yeah, and if you've been in the business a long time, you've sought out the knowledge. So we interact with the right vendors. We understand chemicals. We understand how to mix the chemicals, but that's not true for every organization or business owner. So there needs to be a standard that governs it from one city, one state, from one country to another. There's so many broken practices in our industry, but there's nothing that would make a company or a business owner or even a prospective client to conform, because there's nothing established. And, when I speak of broken practices, if you go to a luxury hotel, luxury doesn't necessarily mean cleanliness. Mm-hmm. And so although your hope is that hotel will be clean regardless of the star level, but it doesn't mean, if they run out of laundry detergent soap, or if they mix something incorrectly, or if they buy a product that doesn't have any disinfectant value to it, they've just purchased that. And you suffer, the public suffers as a result of maybe their lack of knowledge, or simply that from one cleaning crew to the next, they're not following the same structure, regimen, process. It just doesn't exist.
One of the things that I observed when I actually worked in the industry for a short stint is that in a government institution, they ran out of soap. And the soap was on the back of a truck, and it was going to take another 2 weeks for it to get to them. And they literally went to using hand soap to wash dishes with because they had no antibacterial, no germicidal soap available. And nobody, of course, who ate off those plates knew what was going on, and neither did any other. And this is a government institution. So there are some regulations that were supposed to be in place with regards to, not necessarily how they clean, but with regards to what they use to clean. And those things were not used because they weren't available.
And I think another thing that's really interesting is that any and every profession has a governing body and or they are respected for what they do. This is the only profession that has been around for, the first documented process was 1895, but it's the only profession that has not progressed. For one, because it's not really considered a profession. Mm-hmm. It's just considered to be a labor job. So therefore, it's disregarded, disrespected. There's nothing. If you contact a university or college or whatever, there's no career-driven path or process for this industry. Mm-hmm. But at the same time, the cleaning crews are the first line of defense when it comes to protecting the public from infectious diseases.
Absolutely.
So is it important that we train them right, that we create a profession or career level and pay them accordingly? Or in time, do we suffer because of disease? Does our health suffer because we didn't understand the importance of cleanliness and sanitation within our dwelling places or environments that we go to work or, to
learn.
Whatever, whether it be a cruise line or cruise, air carrier, hospitality, wherever you go, you are subject to possibly catching any type of infectious disease if that environment is not cleaned properly.
What types of strides has TNKA made as far as being accepted? What type of reception are you getting from others in the industry about being regulated when there's been such a long period of time without those restraints? I guess it would be viewed in some operators' eyes.
Well, one of the things. Oh, go ahead, Reggie. I'm sorry.
No, please go ahead.
One of the things that, we have put in place, because we're such a new organization and we really are designed to create an alliance. It's not something that a group of people have decided to come together and put this in place and so that we get pushback from the industry. We're talking about joining together an alliance of cleaning industry professionals, veterans, product specialists, service technicians, people who all would pool their knowledge and their abilities and their experiences so that we can create one collective shout. We are not coming to the industry saying, hey, this is what the industry needs. We're coming to the industry as the industry and saying, hey, let's join together, and put together these regulations, ethics, standards to uphold, one of the leading global market segments. Because if we don't do this, our health will suffer.
Well, where can we go online and learn some more about the Trans-National Kempt Association and about Kemp & Sons General Services as well?
So you can go to Trans-National Kempt Association.org. And for those who want to become a member, that gives them all the information on the membership. But then there's also TNKA Association, www.tnkassociation.org. And it gives them all the information about it. We have, every social media channel, so they can look us up on Facebook or Twitter or Instagram, but tnkassociation.org. And we do need people to come join forces with us because we need the community to make the difference. We are now in an era of social media, and that was very important to us to be led by the people. We have a structure of what we want to do and how we want to go forward. But we've learned over time through social media that it is about the people. So we need the people to come join forces with us so that we can make a difference in Congress and legislatively everything that we have to do in order for this to become a regulated industry. It will not only help public health and environmental safety, but it would help with fair wages, fair practices, and it would remove all there's such a disconnect between what is needed in the industry and the importance of communicating from the cleaning company to the end user, just them understanding how it's important to communicate about your facility's needs. We can't assume we know what goes on. They have to communicate with us from the beginning of the contract to the end of the contract.
Well, thank you so much, Reggi Kemp, Patience Rose. Thank you both for coming in today and speaking with us. A great topic and also a great push for some regulation in an industry that actually needs regulation. It's such an important industry. Thank you both for coming in today.
Thank you.
Thank you so much, Bill.
Great. You've been listening to Health Professional Radio. I'm your host, Neil Howard, for this Health Suppliers segment. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.